joining us for another Facebook Live. We're joined tonight by Dr. Tiffany Kimbrough, a mom, pediatrician, and medical director of our newborn nursery, and Carl Ayers, the director of family services for the Department of Social Services. We are talking about safe sleep tonight and hoping to dispel a few myths. We welcome you to ask questions in the comments, and we'll try to get them answered on video. Chimes mean a baby was just born, so perfect timing to talk about safe sleep. Again, any questions, type them in the comments below. We'll try to get them answered live during this video. Carl, can you start by telling us about our joint prevention efforts and why safe sleep is such an important thing to talk about?
Sure. Good evening, everyone. And we have really been working significantly over the last several years around our safe sleep efforts and trying to ensure that we really protect our children and give them the best opportunity to be successful from birth on forward. And we started some significant work in Virginia back in 2016 and did a really deep dive down into our child fatalities. And what we found is that the majority of child fatalities that occur, especially in those that are investigated for potential abuse and neglect, are unsafe sleep practices. And so we convened a team that spent the next year and a half looking at how we can potentially prevent those fatalities, and came together with a partnership with the Children's Hospital along with the VCU School of Social Work, of where we are partnering together to distribute safe sleep education to all new mothers and their families, to distribute a baby box for them for safe sleep practices, and then to do something pretty unique in Virginia in providing a universal nurse home visit after that child is born. And so through that partnership, what we were doing is really studying the outcomes for that and trying our best to ensure that every child that is born, that they are safe and have the perfect opportunity to grow and develop.
Great, thank you. Dr. Kimbrough, one of the most common things we hear about when we talk about safe sleep is always placing a baby on their back. Why is that so important?
So in the mid-1990s, there was a big campaign to start the Back to Sleep campaign, or really changing the messaging around how infants sleep. Before then, it was pretty common practice for babies to be placed on their tummies to sleep. There was the thought that by doing so, it would protect babies from choking in their sleep, and it would also help promote longer sleep for babies at night. With that Back to Sleep campaign, we saw a dramatic decrease in the rates of sleep-related death, and from a rate of anywhere from 150 per 100,000 down to around 90 per 100,000, so almost halved it. But we've seen that rate now stagnate. So despite that messaging being out for almost 2 decades now, those rates haven't continued to decrease despite good public health messaging.
Another baby. It's perfect timing for our Facebook Live. Let's talk cute baby things. Bumpers in the cribs, teddy bears, cozy little blankets. They often match the nursery, they're adorable, but they're not a good idea in the sleep space. Why is that?
That's a really great question. We often think of babies and we think of soft, cuddly, fuzzy things, but the actual safest way for a baby to sleep is on a very firm mattress. When you put your hand or your baby on the mattress, it shouldn't hold it. It shouldn't hold that shape. When the hand or baby is removed, it should remain flat. So a firm mattress with no extra blankets, bumpers, stuffed animals is the safest way for your baby to sleep, to reduce their risk of suffocation in the crib. What we think happens with sleep-related death is that a baby during a critical window of time when they can't move their head out of the way well, they get in a position where they can't breathe, the oxygen level in their body drops, and ultimately they pass away from low oxygen. So if there's a blanket or a bumper or a stuffed animal that gets in front of the baby's face and they can't move their head up out of the way, they're trapped, that leads to either a suffocation, strangulation, or asphyxial death. And so the other danger with bumpers is sometimes they actually come off and they can wrap around baby's neck and can be a strangulation risk. So the environment that we recommend is alone on your back in a safe sleep space that's been approved, like a crib, a pack and play, or a baby box.
Okay. So you're saying that we don't need blankets to keep babies warm. How do you recommend we dress a baby for sleep so they stay warm?
That's a great question, especially as we're getting here into fall and winter and the temperatures are starting to drop. So the recommendations are for babies to wear one extra layer than what mom and dad are comfortable in. So you could have a baby in a onesie and a sleeper like my little nugget is in right now, a hat for a new baby, or you can also use a swaddle blanket if your baby hasn't yet started to roll. So once a baby's rolling over, you should stop swaddling. There's the chance that they could roll and get into a position they couldn't get back out of again. The other thing you can use that I brought is a sleep sack. And especially for parents who are a fan of bumpers, this is a good alternative because it prevents the baby's legs from getting stuck in a slat. So if your baby is more mobile and that's something that happens, a sleep sack might be a good option for you to keep your baby warm. So this is a muslin one that's good in the summertime. You want to avoid overdressing your baby because overheating is another risk factor for sudden unexplained infant death or sleep-related death. So babies that are too hot potentially can also have a higher rate of sleep-related death. So again, one extra layer than mom or dad, keeping the temperature in the house not too hot, and then avoiding extra layers that could make the baby get overheated in the nighttime.
Okay, makes sense. We've talked about the sleep space. How about physically where the baby should be? It's recommended that they sleep in the same room as the parents. How long do you recommend that take place?
So the new guidelines that the American Academy came out with in the last 2 years or so made more strong language that babies should be in the same room as their parent. The ideal is for the first year of life, but ideally the first 6 months. The thought behind room sharing but not bed sharing is that it's easier for mom to breastfeed. They can have free access to babies being in the same room as them. But the other thought is that by hearing parents kind of roll over in bed or those small noises, it prevents babies from getting into too deep of a sleep. Those little micro arousals for the baby are protective by not allowing the baby to get too deep a sleep, that are reducing the risk for sleep-related death. And there were 2 really big studies that showed a 50% decrease in rates of sleep-related death by room sharing with parents.
Let's talk about the American Academy of Pediatrics. We often talk about their recommendations for car seat safety and vaccines. What do they say about co-sleeping? Is that safe?
They have a very strong position statement against sleeping in bed with mom and dad. Unfortunately, when babies are in bed with mom and dad, sometimes we're so tired that we're not as aware of where our babies are in space, and so we can accidentally roll over on top of them, or our blankets can get in front of their face, or our mattresses that are a lot softer than baby mattresses can be a suffocation risk. So that being said, accidents happen. You know, you're trying to nurse in the middle of the night and you do fall asleep, you know, holding your baby. It's important to use your partner and say, you see me fall asleep, or can you help me keep an eye out? If you fall asleep, once you wake up, to put your baby back in their safe sleep space as soon as possible.
Carl, can you tell us a little bit or help to explain the difference between SIDS, SUIDS, and ABBS? Those are terms that we may hear when we talk about infants and safe sleep.
Yeah, sure. One of the things that, unfortunately, that we deal with Child Protective Services and our state child fatality review team is looking at sleep-related deaths and what is actually the cause of death for children after fatality has occurred. And so, traditionally, SIDS has been what people have heard with regards to the deaths that we are looking at. However, that's become a term that is really not used anymore. And so generally that has been replaced with SUIDS, which is the sudden unexplained infant death syndrome. And then also we have begun to see something called ABBS, which is really more around the asphyxiation and the suffocation that is occurring by when the child is. So if you're looking at those terms and you are trying to figure out what exactly do they mean, it is really a changing in the terminology as we have come to understand the differences in the types of related fatalities and what it is that is causing that fatality.
Thanks. Dr. Kimbrough.
Yes.
I remember, it wasn't too long ago, being a very tired new mother, and you kind of try to catch your sleep when and where you can. What recommendations do you have about falling asleep, napping with a baby in your arms, or on another non-approved sleep surface?
What we know is that at least half of those deaths that Carl was referring to, especially in the Commonwealth, were with a baby who was in a co-bedding situation, whether that was on a sofa, armchair, or in bed with parents. And so that's one of the most risky things that we can do, is to have babies on a non-approved sleep surface with another adult, particularly if that adult is not mom. So dads, grandparents, etc. have a higher rate of that happening. Accidents, again, do happen. So using all your resources, all your team, that village that's around you to help support both moms and dads in that exhausted new parent phase of, if you see me accidentally falling asleep, please help me, and help baby get back into a safe sleep environment. So we acknowledge that accidents happen, and we try to make sure that parents are informed about what to do when that occurs. I think the other important thing to remember is, if that accident happens, that you don't say in your brain, that accident happened, nothing bad happened, my baby was fine. So then this becomes common practice, and I keep doing it because it was okay once or twice.
What are some other non-approved sleep surfaces that we should be careful to avoid?
Yeah, so I see a lot of new parents purchasing DACA tots and Orange Beach co-sleepers and rock and plays. And it's not that those items are inherently unsafe, we just don't know that they're safe. So they aren't marketed as sleep surfaces, so they don't meet CPSC standards like a crib and a pack and play do. They haven't had all the rigorous studies to show that they're safe sleep spaces, because their manufacturers don't say they're meant for infants to sleep in. So as a pediatrician, for all my patients, I'm never going to tell you that something is okay to do if I don't know that it's okay to do. So I just can't say, yes, put your baby in a rock and play, or let your baby sleep in their car seat even, if they happen to fall asleep in the car, because we just don't know that it's an okay thing for babies to do. One of the concerns with rock and plays or car seat carriers is that babies are more prone to having a head down position, and that head down can potentially obstruct the airway. And so without having that study done to know that they're safe, we can't say, let your baby be in the rock and play, or let your baby be in their car seat. So if your baby accidentally falls asleep in the car while you're driving and you come inside, go ahead and transition them into their safe sleep environment if they're still due for finishing out their nap.
We talked about the baby box. Can you show it to
Yeah.
us really quick so we understand?
And
I can pick it up while you...
I'm going to put my model in it also
Okay,
as a demo.
perfect.
So this is my little nugget. So the baby box is awesome. This is a cardboard box that has a fitted sheet and mattress at the bottom. And Isla here is demonstrating when your baby should transition out of their baby box, because she's able to pull up on the side. So she's a little too big these days for the baby box. Off camera baby. But in the early months, so usually to 4 to 6 months of age, this is a great way for babies to have a safe sleep environment. So the mattress is firm, the sheet is fitted, the sides are, obviously there's no fabric around the sides, and this is a portable sleep option. So if you are going over to be with grandma for the evening, you can take this with you and still have a place that is okay for your baby to sleep in that environment. I also encourage it for families who maybe have 2 floors at home. This is a great way for your baby to have a spot, maybe in the first floor of your home while your crib is upstairs.
Great. Is there anything that either of you can think of that we haven't covered that would be important for parents to know?
Yeah, I'd just like to add a couple of other things with the baby box. Is whenever we reached out and talked about the conversation with the baby box, it's really not the baby box itself or the pack and play or the crib. It's around ensuring that you have the appropriate safe sleep environment for the child. And so any combination of those safe sleep environments are what the message is that we're talking about. And so if you go to, we developed a statewide safe sleep website that has a lot of avenues that are out there. So safesleep365.com is a great resource for families to be able to go out, research, talk through ideas, look at it. It has links. But one of the wonderful things about the baby box is that you can actually do kind of a 15 to 20 minute education on safe sleep. And so then if you do that, then you can actually get a baby box for free. So for those families that are struggling with the money to be able to purchase a safe sleep environment or something along those lines, part of our partnership was to be able to provide that to everyone as part of the safe sleep education. In addition to that, when we're talking about the safe sleep practices, we're always talking about alone, apart, and always. So you heard Dr. Kimbrough really talk about some of the challenges and some of the dangers of sleeping with your children in unsafe sleep environments. And so we just want to continue to hit that message and talk about it over and over so that people understand what we're talking about is reducing risk, is reducing the chance that a child would be a fatality related to one of these unsafe sleep environments.
I think the other thing that strikes me when I think about unsafe sleep is that it can strike any family, and we talk about this being a rare event, which luckily it is. But the same way that lightning strikes are a rare event, you don't go out in the middle of a baseball field with a bat up in the sky in the middle of a thunderstorm. So you, as a parent, when you're thinking about how can I keep my baby the safest possible, and what are the things that are really important for me to do, knowing that sleep-related death is the #1 killer for healthy babies through age 1, even though it's a rare event, if something were to happen to your baby, this is the most likely thing that it would be. And so I think that safe sleep messaging is as important as we talk about vaccines and we talk about putting your baby in the car seat properly. All those things are important messages to keep your baby safe, and this is one of those messages that we hope hits home for families as we're going through all of our guidance.
Great. Carl, can you remind us just one more time how families can get a baby box?
Sure. So Baby Box University is where you actually go to get the baby box. You can just do a Google search. You can go to our safesleep365.com website. Any way that you go there, and it really is just a simple sign up, and then you go through and you do the safe sleep education. And once you do the safe sleep education video, you can either choose to have the box sent to you and mailed to your house, or you can choose to pick it up from a distribution site. So the process in and of itself is really relatively simple to be able to get that baby box and be able to get it to you. Part of our partnership that we talked about with the Children's Hospital here is that if your child is born here, is that is actually part of the safe sleep education that we're doing, and the ability to be able to do all that in the hospital. So you wouldn't even have to do it afterwards or beforehand, that sort of thing. But just to reiterate to everyone is Baby Box University. You can do a very quick Google search, bring it up, or you can go to our Safe Sleep website, safesleep365.com.
Great. Well, thank you both very much for this insight. Thank you all for joining us. Again, safesleep365.com if you need some more info. And please join us next Wednesday. We'll be live talking about mental health resources in our community.